Inferior vena cava, vena cava inferior. It forms with the help of what? Common iliac veins. Common iliac from internal iliac and external iliac. External iliac vein, that is continuation of femoral vein. Femoral vein start from popliteal. And popliteal vein, tibialis anterior and posterior. And in lower extremity, the same like in upper extremity, we have two types of veins.
Deep and superficial.
Deep and superficial. Superficial veins are on medial side, well, that is big toe, second, third, fourth, fifth, that is foot. And from medial side of the foot start vena saphena magna. Vena saphena magna. This is superficial vein which opens into femoral vein below of inguinal ligament. And on lateral side we have vena saphena parva, and vena saphena parva opens into popliteal vein. Only two superficial veins in lower extremity, greater and lesser saphenous veins, subcutaneous veins on lower extremity. Deep veins, the same like arteries, all of them are double veins except popliteal and femoral. They are single veins. All in other veins, double anterior tibial, posterior tibial, fibular, vena dorsalis pedis, vena plantaris, medialis and lateralis, all of them are double veins. Cleatis. What else? Femoral veins, the same receives superficial epigastric vein, vena circumflexa ilium superficialis, external pudendal veins. They are also opens into femoral veins. Sometimes they opens into greater saphenous vein. For example, superficial epigastric sometimes opens into vena saphena magna, and vena saphena magna opens into femoral, and sometimes they opens independently into femoral vein. Deep femoral vein we have external iliac vein has the same tributaries like arteries, that is vena circumflexa ilium profunda and vena epigastrica inferior. Internal iliac vein has the same tributaries like branches of internal iliac artery except umbilical vein. Umbilical vein here is absent, but vena vesicalis superior and inferior, vena rectalis media, vena uterina, vena ductus deferentis, all of them, vena glutea superior, glutea inferior, vena pudenda interna, vena obturatoria, all of them are the same like arteries. Next, inferior vena cava, vena cava inferior. No, you already know vena lumbalis, what? Vena lumbalis, which opens into inferior vena cava. We join together with vena lumbalis ascendens. Then here is diaphragm, and inferior vena cava opens into right atrium. Yes, here it is heart. This is right atrium, and inferior vena cava opens into right atrium. What else? It receives veins from paired organs. For example, vena renalis. This is left, and here it is right vena renalis. Then vena testicularis or vena avarica. But on the right side, vena testicularis or vena avarica directly opens into inferior vena cava. On the left side, vena testicularis or vena avarica opens into what? Renal vein, and then renal vein goes to inferior vena cava, and the same with suprarenal veins. On the right side, vena suprarenalis dextra goes to inferior vena cava. but vena suprarenalis sinistra opens into left renal vein. And last, it is liver, and blood from liver goes to inferior vena cava through vena hepatica. We have 3, 4, sometimes 5 hepatic veins. Vena hepatica opens into inferior vena cava. They are system of inferior vena cava. Some words about portal vein. From all unpaired organs in abdominal cavity, blood goes to portal vein. Portal vein forms with the help of splenic vein, vena lienalis from spleen, vena mesenterica. This is inferior, and it is vena mesenterica superior. Inferior mesenteric vein forms with the help of left colic, sigmoid vein, and
rectalis superior.
Vena rectalis superior. Vena mesenterica superior, it receives vena intestinalis, ileocolic vein, right colic,
medial
and medial colic vein. They are the same like arteries. What else? Portal vein, vena porta, it receives vena gastrica sinistra, vena gastrica dextra, prepyloric, vena prepyloric vein, cystic vein, vena cystica, sometime into portal vein, sometime into right branch of the portal vein, vena cystica, and para-umbilical veins, vena para-umbilicalis. They start from anterior abdominal wall, from venous plexus on anterior abdominal wall, and goes to portal vein, or sometimes it opens into left branch of the portal vein. It is not so important. They are system of portal, and blood from all of these organs goes to portal vein. Portal vein brings deoxygenated blood to liver. In liver, you remember that in lobule of liver, interlobular vein, which is continuation of portal, interlobular goes into the lobule, mixed with oxygenated blood from hepatic artery, and mixed blood passes through sinusoid capillaries, opens into central veins, and then vena centralis joined together makes collecting veins, and collecting veins makes hepatic veins, and hepatic veins opens into inferior vena cava. That is system of portal vein, inferior vena cava, and portal vein next time. Your questions?